Let's begin, shall we? Good evening, everyone. My name is Melanie Ng. I'm the news anchor with Breakfast Television here in Toronto, and I'm so pleased to be able to join you as moderator for this very important panel discussion. It is all about mental health presented by RBC. I want to take everyone the moment here to say thank you for joining. Everyone has such a busy schedule, but this is such an important topic that we really do need to delve into. And Mackenzie Health has an incredible team, very talented, a number of mental health clinicians who are available this evening, and they're going to share their expertise answering some of the questions that you've actually submitted over the last couple of weeks. I want to introduce you to all of our panelists in just a moment, but first, I want to introduce a greeting from Rena Piliteri from our presenting partner, RBC.
Greetings on behalf of RBC World Bank, and it's our sincere pleasure to be here this evening supporting our Mackenzie Health experts for this very important conversation. It has been so important during this pandemic to prioritize our mental well-being, and Mackenzie Health has done an incredible job reminding us how important it is to take care of ourselves. At RBC World Bank, we're more than just banking. We help our clients thrive and our communities prosper, and it's very important to help mental wellness of all our employees in our community at large. That's why our partnership with Mackenzie Health is so important, and that is why RBC World Bank has contributed over $2 million towards patient care. As chair of the Mackenzie Health Foundation board, I see firsthand the positive impact Mackenzie Health has on our community. We are all perfectly human, regardless of the challenges that anyone faces. Our hope at RBC is that after we listen to this conversation this evening, that we create an environment where it's safe to speak up and that we combat the stigma of mental health.
Okay, Rena, thank you so much for that. And I'm going to give you a snapshot of what we're going to be doing this evening. As I mentioned in that intro, we have a number of esteemed panelists joining us tonight, and we will be diving a little bit deeper. First, we're going to be hearing from Dr. Sharif Marzouk. He is a psychiatrist at Mackenzie Health, and we're going to be talking with him about some of the impacts specifically on seniors' mental health, and that's the conversation that we will be joining him with. Angela Pai will be joining us. She's a social worker in adult and child and family outpatient services. Specifically, the focus here will be about parents and how they can support their younger ones. We know this year has been really difficult, actually the last couple of school years on top of that when it comes to both the remote and in-school learning. So, the changes that have been happening through the school years. Heather Hunter, a social worker in the intake and urgent care clinic, she'll be talking about some of those preventative measures and some of those mental health resources that are available to the community. So very important here. And Adel Siddikin, who is a crisis intervention worker in the emergency department. And the focus here will be about acute care that she provides to patients in crisis, along with some strategies, very important strategies when it comes to coping those mental health challenges that so many people are dealing with on a day-to-day. So just so you all are aware, we're getting participants constantly coming in here. There have been a number of questions that have been submitted over the last few weeks. We're going to do our very best to get through as many as we can tonight, and they sort of go along certain themes, some frequently asked questions or ones that a lot of people are just wondering about theme-wise, and so we'll get to as many of them as we can. So let's first introduce and get to know our panelists so you can see where their expertise lies. So I'm going to begin with Dr. Marzouk, and as mentioned, a psychiatrist at Mackenzie Health. And what we're going to do tonight, before we hear from each panelist and hear their area of expertise, is hear about them. And we're going to start with something unique about them. And I am just learning this, Dr. Marzouk, that you are a competitive squash player. This sounds intense.
Yeah, it's about exercise. I hope we get into discussing exercise and the positive effects of exercise on mental health and well-being. And I've always been into squash is my side sport.
What is it about squash that you love so much?
That you get worked out so quickly, in a half an hour. It's so intense.
And that is why I bow down to you, because I would be out in about 5 minutes. So yes, congratulations to you, and at a competitive level as well. Dr. Marzouk, for those who are not familiar, can you share what you do at Mackenzie, at your area of expertise?
Absolutely. And so my capacity is really, I'm an academic clinician. So academically, um, I'm a teacher to medical students and residents, as well as participating in some research, primarily in the domain of cognitive and mood symptoms in lupus and the immunosuppressed population. My clinical area of focus is neuropsychiatry and geriatric psychiatry, as well as some sleep medicine. Neuropsychiatry, to simplify, it's neuropsychiatry or organic psychiatry, and it's that branch of medicine that deals with psychiatry as it relates to neurology. In an effort to sort of understand the neurological underpinnings of psychiatric and neurological disorders and help these patients with these neurological conditions, particularly those conditions that affect behavior. As for geriatric psychiatry at Mackenzie Health here, it's really a growing program, and the goal is to eventually have an integrated continuum of just leading practice services in geriatric mental health here in the hospital to serve our region. And within geriatric psychiatry, my area of interest is really dementia support and late life depression, including its diagnosis, treatment, as well as depression as a possible precursor for the dementia in later life and management strategies.
Okay, thank you for that, Dr. Marzouk. And as mentioned, we had a lot of questions with regards to the older population and some of the challenges when it comes to mental health. So we will dive a little bit deeper in that. For those who are just joining us now, thank you for doing so. I just want to remind everyone that this session is being recorded. So perhaps if you missed a piece of it, you can go backward and listen to earlier parts of the conversation in case you missed something or you have to log off early. No worries, you'll be able to see the full session, the full panel as soon as it is available. All right, so thank you for that, Dr. Marzouk. Next up, I would like to introduce Angela Pai, who is a social worker at Mackenzie Health's outpatient clinic, supporting adults, children, and their families. So very important, Angela, because there are so many questions that we have received here specifically about the younger population as well. But first for you, your question, something that we learned, you like the need for speed, sort of. What would that mean?
Yeah, so years ago, when I was much younger, I had the impulse to get my motorcycle license. So I got my license and, it was such a thrill in just learning how to ride a motorcycle. But then I looked into the budget, how much it costs, helmet, gear, bike itself, and the fact that winter is so long in Canada, it just was not worthwhile. So I actually never got to ride a motorcycle in the streets. So that's sort of like a lost cause for now. Perhaps I'll entertain that idea again in the future, but that's a fun fact about me that I don't think many people know.
Well, now all of our participants know. So thank you for sharing that one, Angela. And for those who don't know you outside of the motorcycle love, tell us a little bit more about what you do on a day-to-day and what the last year and last couple of years have been like for your expertise.
Yes, I think it's such a privilege for me to work with adults, children, and families within the mental health field. And I think throughout the pandemic, I've been working with people in all different ages, right? And I think what I've been hearing is common across the board is stress, anxiety, feelings of depression, isolation, just also difficulty managing all of the constant changes that are thrown at people, right? There's a lot of chaos, in-person learning, then virtual, then maybe daycare closures, work from home, not work from home. And then I think the unique challenge for the community is kids, teens, and families with kids and teens. So I think that's something that I can speak to tonight. So I'm really grateful for this opportunity to speak with everybody.
Amazing. Thank you so much for that, Angela. And again, as mentioned, we did have a lot of questions with the family dynamics. So we're looking forward to hearing more about that. Now, I want to introduce Heather Hunter, who's a social worker who is the first point of contact. So for those who are seeking urgent mental health care, Heather will be one of the individuals who you would see. And Heather, as we speak about families, I understand you've got a very busy juggle, and that juggle involves a toddler. So that's fun.
Yes, the teenager stage is very strong in my.
I love that term three-nager because it is so very true. You've got a little one, your arms are full, you've got busy work schedules. So how do you do the juggle?
I do the same thing I tell my patients to do, only sometimes not as much as I should. So, take time for yourself, try to exercise more, make sure you're sleeping and eating well, and ask for help when you need it. I tell my patients every day. I should take my own advice more often, I think. I think a lot of people in this profession would also agree.
Absolutely. So tell us a little bit more, if you wouldn't mind, just elaborating a bit on what you do on a day-to-day.
Sure. So I'm a social worker with the Intake and Urgent Care Clinic, and it's a clinic that we run here at Mackenzie Health that is social work and psychiatrist. We have a psychiatrist that's paired with our clinic, and we are the first point of contact for most patients who are referred to our services. So we review all the referrals, and then we offer intake assessments, therapeutic intake assessments to patients who require some extra assessment. And then from there, we're able to prioritize patients who need to be expedited into either our mental health therapeutic services or for a psychiatric assessment. We also provide some short-term crisis counseling to help people stabilize a little bit when they're facing some acute stresses.
Okay, wonderful. Thank you so much for that. Looking forward to hearing more from you. And I'm going to introduce our final speaker this evening, and that is Adel Siddikin, who is a crisis intervention worker in the emergency department. So she sees patients when they first arrive at the hospital in a crisis situation. Adel, I want to ask you this. This is your line of work, as all of our panelists here. It can be heavy. How do you not take that work home with you?
So for me, a practice has been spending time with my kids or playing with my dog. It keeps me present in the moment, as well as helps me leave work at work. It's that self-care piece and, self-compassion.
Yeah. What kind of dog do you have?
Husky, so very busy.
Very busy. There you go. And Adel, for you, what is the day-to-day like? What have you been seeing with some of your patients?
Sure. So the crisis intervention team is available 24 hours, 7 days a week at both facilities. And it's made of social workers as well as nurse. We work closely with the emergency department, a psychiatrist, as well as the outpatient clinic. Anyone that's presenting into the emergency with an acute mental health crisis. So what that means is anyone that's not able to cope, experiencing behaviors or feelings which can lead them to harm themselves or others, or they're no longer able to care for themselves or function in the community in a healthy manner. So the team is basically, our main goal is to resolve the immediate crisis, to assist the individual to turn back to pre-crisis state and assure that the individual receives linkage to the correct level of care. During the unpredictable and ever-changing time, heading back to school or work can be extremely stressful. And as a result, stress can exacerbate some of people's pre-existing mental health conditions, as well as contribute to mental health crisis. So some coping strategies that I would recommend would be to practice self-care and self-compassion. Check in with yourself regularly. What does your body need? Do you need more sleep? Do you need less stress? Do you need more energy? Acknowledge what you have control over versus what you cannot control. So whether that's making a list of things that you can control versus things that you cannot control. Creating a structure for your day and a flow. Creating a daily routine will help motivate, energize, and ground us. And possibly finding ways to relax your mind and body, whether that's taking a shower, using your senses to ground, meditate, or practicing deep breathing. As a result of this pandemic, we've seen an increase in addictions in the emerge, as well as senior population coming in due to isolation and dual diagnosis. So individuals who would have respite programs, they would have day programs. Due to the COVID virus, they were shut down and they are at home without programming.
Yeah, indeed. There have been a number of challenges across the board for everyone here. Thank you so much, Adel, Heather, Angela, and Dr. Marzouk. I'm just doing a quick time check here, and it looks like we're on track. So what we're going to do here is move to our Q&A portion. So again, we're going to try to get through as many of these questions as possible, and I'm going to direct the questions to who I believe would be able to provide the answers that make the most sense. But again, please do feel free. You can use a signal, you can tap your nose, pat your head, whatever you like, and then I can come to you if you'd like to add any additional answers here. So I'm going to begin here with you, Dr. Marzouk. This question coming in My elderly parent is becoming withdrawn, irritable, and is beginning to forget things. How do I know if this is normal anxiety or nervousness related to the pandemic and not something that needs professional attention, like perhaps dementia?
All right. Well, thank you so much. That's a great question. I think I'd like to maybe start by addressing the fact quote unquote like normal anxiety. And there's that central myth in assessing like older adults in that pathology is almost considered to be normative, and which is absolutely not true. Like cognitive decline, anxiety, depression, pain, confusion are just not part of the aging process. And these are signs of possibly of a problem that should be assessed and taken seriously when we see these symptoms in our elderly. Speaking of dementia, because I think the question is wondering if it's dementia. Dementia is generally a progressive illness. How quickly it progresses, it really varies greatly depending on the person and what's going on. It's a syndrome that can really be caused by probably over 100 different disorders and there is a deterioration in the cognitive functioning of the patient, and that seems to be the central theme of dementia. So really before the diagnosis of dementia, all possible illnesses or causes that can lead to the cognitive decline need to be ruled out. And amongst these causes would be anxiety and depression. So anxiety is strongly suggested to be one of these modifiable risk factors for dementia. And there was a meta-analysis or an analysis of the data that we have in the literature that was just published last year. And it looked at databases between 2018 and 2020 and reported and was speaking to the association of anxiety leading to dementia down the road. And the results actually, they included in the ballpark 30,000 participants, and the overall relative risk. And what relative risk is, it just tells us how much more likely if we have anxiety to develop dementia, came at 1.25, so 25% more likely if there is anxiety in senior life that it can progress to dementia. So in conclusion of that meta-analysis, it really concluded that the treatment and prevention of anxiety can help in reducing dementia incidence rate. But there's clearly need for more research, as we're not clear as to whether the anxiety is a cause of the dementia or is it part of the prodrome leading to the dementia. What seems to complicate the picture a little bit more now that we can speak of also depression, because as we get older, mood symptoms, like the typical mood symptoms that we would see of depression, including sadness, crying, the feeling depressed, are often absent in the elderly. And in fact, it often shows with this irritability, feeling stressed out, short-fused, and symptoms of dementia slowly kick in over time. And if we look at symptoms of dementia, they're very similar to depression. So patients would complain of the memory problems, of the social withdrawal, the difficulty focusing and sustaining attention. In dementia, we would see more difficulty finding words, more difficulty communicating, maybe losing social graces. It depends on the type of dementia, whereas in depression, we would see slowness in movements and speech, fatigue and tiredness, and just this lack of motivation and oomph to get up and go and do things. So I'm trying to highlight that dementia and depression as well, they are very strongly correlated and are thought to share some common risk factors, including inflammation. That said, the direction in which one progresses to another is poorly understood. So does the depression increase the risk of dementia, or does the dementia increase the risk of depression? Is depression a part of the clinical syndrome of dementia, or do they both simply share common grounds? It's more likely that depression seen in patients with dementia is really multifactorial, and in some cases can lead to progression of the neurodegenerative process and full-blown dementia. As well, I'm just keeping track of time, but patients with Alzheimer's dementia appear to be at a higher risk of developing depression than the general population. Now, conversely, patients with depression appear to be at a greater risk of developing Alzheimer's dementia down the road as well. And just one last thing is that there was another recent meta-analysis that included individuals with depression at baseline, and this study showed that people with depression at baseline are at a higher risk of developing dementia, and the risk ratio here was 1.7. So it's 70% more likely that if we have untreated depression in later life, that it can possibly, or in that case, likely progress to dementia. And we got to keep in mind that there are several lifestyle factors that are associated with long-standing depression, and these factors can be associated with increasing the dementia risk, including diet, the social engagement, the physical activity. So with all that said, coming back to the index question, I would say that yes, it would definitely be a good idea to get a thorough assessment. It would be necessary to rule out any reversible medical or psychiatric conditions that can have overlapping symptoms, and they do seem to mimic each other. Yes, I hope that addresses the question, Melanie.
Yeah, that's wonderful. Thank you so much for that, Dr. Marzouk. Appreciate that. This next question is specific to teenagers. So, Angela, this one will go to you. And this is the question. My 16-year-old has replaced regular social interactions with video games. How can I help him to feel connected to the world and resume social interactions with his friends again? I can't even tell you how many times I've heard a lot of my parent friends who've said the exact same thing. So I am listening intently.
Yes, and that's a very common concern for parents with teens or families with teens. I think firstly, it's helpful for parents to try and learn and understand from the teens' perspective, because to the teens, it is a source of validation, connection. They do get to experience a sense of reward and accomplishment through, depending on what kind of game that they're playing. But to them, it's a legitimate way or a source for them to kind of get that connection, right? And especially if we think back to the last year and a half, majority of the year, they were restricted to physically hanging out with their friends. So there was a time where they didn't really have the option. Even if they did want to hang out with their friend, perhaps, family said, it's against the rules, just to be safe. You can't do that right now. So I think it's important for parents to kind of acknowledge that as well, is that throughout the pandemic, there was a period of time where they didn't have that option. I would also suggest for the parents to try and get to know what games they're playing. Right? And also depending on teens, because there's so many different types of games out there, it's getting an understanding of what do they get out of playing that game that they're playing, right? If they're playing with other online players and they're actually talking to them, chatting with them, they do get a sense of connection through that medium. And I think it's also, and I tell parents this all the time, it's really important for us to model the behavior that they want to see, right? So check your own behavior with using your phone and internet and laptop at home, right? Because a 16-year-old will kind of think to themselves, well, you're on your phone all the time, so why am I going to listen to you, right? So, and then a couple of tips that I have is try to involve them in setting the limits to their game time. And you might have to do this gradually, right? If they're playing 4 to 5 hours a day, you can, but the consequence of immediately removing that and have no access at all, they're going to really feel upset. and sometimes rightfully so, right? So you might want to do this in a gradual way, starting to set limits, involve them in setting the limits. I think it might also be helpful to kind of work with the teens so that they do some things to earn their game time. So it might not be freely given to them. Say, you know, what if you get this and this and this done, you can play an X amount of whatever time that you have for the gaming, right? And then I will kind of highlight the good qualities of their peers, and then also remind them of past positive memories when they did physically hang out with them. Because sometimes when we're stuck in feeling sad or anxious, we look for social media or video games for that quick relief. So it's kind of easy to forget, oh, I did have time, fun with my teens or whatever it is, right? And then encourage them, help them set up plans to hang out with friends. If they're kind of hesitant, maybe reach out to their friends' parents if you have their contacts to actually help facilitate that. I think those are the tips that I would have for families. Yeah.
All really great tips. And I know as soon as you said, check yourself and see how much screen time you're personally doing, we all kind of smiled, because I think we're all very guilty of that. So it's a great tip, because it can easily be sort of thrown back, right? And for us to be a constant reminder of what we are doing. So thank you for that, Angela. Okay, the next question will be for Heather. So Heather, this question is about families. So how can families support their loved ones, especially if they are at risk of burning out themselves, trying to balance work and caring for loved ones? That's a tough balance. And are there resources that they can access?
As a parent myself with aging parents, I feel this one really hard, I know, and it's something that a lot of my patients are struggling with as well. I think that my main advice would always that you need to make sure you're looking after yourself. They tell you to put your oxygen mask on before others for a reason. It's really hard to help people if you're on empty. And often I think that the difficulty is that we don't recognize those symptoms of chronic stress until we're burnt out. And so it's a good idea in these types of environments when you know that you're running really fast and your wheels are spinning and you've got lots on the go to do, like take some time to check in with yourself, to be intentional about it and really be honest about how you're feeling. I think it's important to recognize your own limits and to be able to identify and maintain appropriate boundaries with others, because sometimes that can get a little wishy-washy when we're struggling. And especially I think when we're with our kids and our aging parents, we want to be able to do everything and make everything better for them, but sometimes we can't. And it's important to be able to acknowledge that. And I think it's also important to know and acknowledge when we have unreasonable expectations of ourselves or when others have unreasonable expectations of us, and how to manage that. And the other thing is to keep an eye out for the symptoms of the chronic stress. So things like poor sleep, changes in your appetite, increased irritability, poor concentration and focus, the forgetfulness, increased substance use is a big one that I know Adel and I have been seeing a lot of, and I'm sure Angela has too with her teens. People are drinking and using drugs a lot more than they were before. I think I saw a stat recently that the LCBO's sales are up like 20 or 40% over the pandemic. And I think KMH has been doing a lot of work around research into the substance use, and young moms of young children are a big driver of that. And so it's important to kind of be real with yourself and to kind of check your own coping strategies, because oftentimes when we're in that panic or that kind of wheels spinning, we can rely on things that aren't so healthy for us. And some of the things to look and change is to, when your plate is too full, you need to look at how you can take the load off. And so that could look like just prioritizing. Maybe you need to really look at what is important and what isn't important to you and to your family, asking people to help, which is often a difficult thing for a lot of people to do. Allowing people to help you is another one too. So they might not do it as well as you think you would, but it's important to get some help. And also even just having venting sessions with your family or friends to either get help or just even to have some understanding that you're struggling. And the other thing is to ask for what you need. And sometimes you need to demand it. So if you need to have a break and you need to have an afternoon to yourself, or you need to go and have a nap, to be able to own that and be able to ask for it. And I think that if you do struggle with those types of things, going and seek out a therapist could be a very helpful strategy in order to manage, to kind of help with identifying those boundaries and what those boundaries are for you, how to manage some conflict, and as well as any other things that might be contributing to you being unable to empty your plate. And I think Dr. Marzouk mentioned it right off at the top, is that exercise is one of the best, easiest, and most immediate things you can do to help manage stress. In terms of, you can get out and walk, you can go and do whatever it is that you like to do. It's often one of those things that gets put on the back burner when we're really busy. And I know myself, when I was struggling during the pandemic, when daycare was shutting down and work was really busy, a colleague and I actually decided, we're going to go work out in our offices. And so we challenged ourselves to do it every lunch. And in like 3 weeks, I felt so much better. So taking my own advice worked out well for me. I would encourage everyone else to also try it. There's lots of things, whether it's going to the gym, if you're comfortable doing a yoga video online, start small and build up. So if it's just something like, if you're a total couch potato, it's really hard for you to be able to do it. Maybe work on doing 5 minutes a day of doing something intentional that's active, and then build from there. It can really make a big difference in terms of your mood and your stress management.
Thank you for that. And I think, when someone hears physical activity, they get thrown off by, well, I don't have the 20 minutes, I don't have the half hour, but thank you for saying the 5 minutes can make a difference. And if you feel good, you can build up from there and build up from there. Very quick follow-up question for you, Heather. You kind of listed a number of things that you should keep track of if your plate is full.
Yeah.
Should you be keeping track, literally writing things down of, here's where I'm being stretched, or I'm being pulled in all these directions. Where can I maybe ask for help? Where do I need to ditch this, or maybe pass it on to someone else because I can't handle it right now? Should you physically write something down for yourself?
That's a great point. I think it depends on how people like to learn, right? Or how they like to see things. Some people like to draw it in pictures. Some people like to write it down as a list. One thing, especially I think in families, is really helpful is I use a strategy called emotional bucket. So it's around the idea that we all carry around our emotions in a bucket, and what goes into our bucket and how do we get rid of it. It's something that families can do together. So, you can do it with your parents, you can do it with your spouse, you can do it with your kids, and have a conversation around what everyone's bucket is holding and how we can help each other, and make it a collective effort to help to kind of make everyone's responsibility around how do we help each other unload our buckets, right? Whether that's kids put away their Lego so mom doesn't step on them, or, maybe your mother doesn't call you 5 times a day because she knows you're busy at work. So you can work at it together.
Perfect. Thank you so much for that, Heather. And I feel like you're speaking from experience with the stepping on the Lego.
I might feel like I'm finding some of these things myself.
That's all good. Yeah. Thank you so much for that. Okay, the next question is for you, Adel. The question is this: what supports are available to seniors who are struggling with isolation and their limited social interactions because of the pandemic? So what can they do?
Yeah, so older adults who are lonely or socially isolated are at a greater risk for serious mental health or medical conditions. Some resources that are available in the community include chats. So they have the home help program, which is support service to assist the client with routine household activities of daily living, light housekeeping, management, shopping, and meal prep. They also offer social program, the adult day program, which is like exercise, mental stimulation. They have social and wellness program, which promotes health and wellness. They have the diversity and wellness outreach program, which is socialization through engaging cultural programs to celebrate our diverse culture and community. So they offer programs in Iranian, Russian, Chinese, Italian, South Asian, and Tamil for Tamil seniors. There are programs also available through the community centers, through Richmond Hill and Vaughan. Some are specific to adult 55 and up. Generally, they cost about $1 in fee-wise. So they include programs like badminton, craft, table tennis. The Vaughan community offers 65 and up, and they have dance, seniors, fitness, qigong, line dancing, yoga. Through the Thornhill Center, they have the Seniors Club, as well as Rouge River Community offers, again, wellness and muscle exercise, the yoga class, arts and craft. If you are concerned for someone's mental health and they are isolated, there is the IPOP program, which is Integrated Psychogeriatric Outreach Program. This includes seniors with complex challenges such as dementia, addiction, and mental health. and behavioral issues. A team goes up and assesses them in the home. That includes a psychiatrist, a nurse, a behaviorist.
Oh, that's a lot. Sorry, I was still waiting for more. There was a very long list there. And by the way, if any of our participants, if you missed that, if you were maybe trying to jot all of that down, no worries. This will all get posted through the video after. Adel, thank you so much for that. And don't go far, because the next question I'd like to bring you back in for this as well. Actually, for yourself and Heather. This question coming to us asking, how can we support families, and this is an important one, who cannot be with or say goodbye to their loved ones that are in hospital because of visitor restrictions during the pandemic? And since you are already unmuted, Adel, I'll go to you first.
Sure. So during the height of the pandemic, visitor restrictions were put in place to keep patients and families safe and minimize the spread of the virus. We recognize how important it is for patients to be surrounded by family and friends while they are in the hospital. To help patients and families stay connected, one of the initiatives that Mackenzie Health has taken is we've made all TV, internet, and phone access free on tablets available at each bedside. Free Wi-Fi is also available, so patients can video chat with their loved ones from their own device. Video calls may be completed through Zoom. We actually have on our site, it actually shows you step-by-step for those individuals that are not tech savvy, how to connect to Zoom and what the steps are. And as always, an exception may be allowed for a brief hospital visit for family members to say goodbye for their loved one. We understand how important it is in part of the healthcare, part of the treatment plan to include family. Heather, I'm not sure if.
No, I think you handled it. I think the only thing too is to really comment that, every unit has a social worker that's assigned to them. And so I would encourage anybody who's concerned, if they feel like they're not being able to visit as much as they think they should, or if they have any worries, to speak to the social worker, the clinical team, or the PCC on the unit. We as healthcare providers, the staff would love to have patients' families there. They help provide care, they help make sure patients are happy and safe and supported. And it's just that we have to make that decision that it's too risky right now, I think, to include too many people. And it's difficult for all of us. But I think Adel made a really good point in terms of, especially with people who are going through end of life. I know that every unit has different policies depending on the unique needs of their unit and their patient group. So I would encourage anyone who has worries to speak to the team. And I'm sure that they can be able to be collaborative and come up with some great solutions to be able to address their worries.
Okay, great. Heather, Adel, thank you so much for that. Angela, I'm going to come back to you because this question is specifically about teenagers. And I'm going to say the first statement, and this will not be a surprise, but now we have to look for a solution. And the statement being, teens don't tend to share much with their parents. Yeah, not much of a surprise there. But the question being, what can I do to ensure I am not missing signs of mental health issues and make sure that they are adjusting to all of this change and in a healthy way?
Yeah, I think that's an important question. And I don't know, we've all been teens ourselves, right? I don't know about you. I didn't really share much with my parents when I was a teenager. So I think some of those markers that Dr. Marzouk had mentioned earlier in our meeting today can be applicable to teens as well. So you're looking for significant, sudden, abrupt changes in your child's personality or behavior. And also, we as clinicians, we kind of look for a level of functioning, right? But families can do this too, where there's changes in attendance, academic performance, maybe social patterns, impaired motivation. There's not that oomph or that vitality to their day-to-day, right? So, or they're starting to avoid activities that they used to enjoy once upon a time. Also changes in physical appearance, because sometimes when we're feeling depressed or anxious, we stop taking care of ourselves. So hygiene-wise, maybe look for those as well, and changes in sleep, appetite, irritability, if they're not usually kind of snappy, but all of a sudden they're talking back at you, those types of things, right? And also you want to look for changes in energy level. So they're complaining of feeling tired all the time, fatigued, or the other way around, they seem to have too much energy that's kind of unusual for them, right? You also want to look for if they're doing more engaging in unhealthy ways of coping. So is there increased substance use in the teenager, or are they engaging in self-harm behaviors, right? Or if they're talking about there's talks of hopelessness or a sense of powerlessness or helplessness, or if they're talking about, suicidal thoughts or those types of things, you would really want to be looking out and want to take care of them for that. And in terms of what to do to help them cope in a healthy way, I think it's really important to engage the teens. Have a conversation with them about what's important to you. Like, what would bring you a sense of purpose and meaning to your day-to-day life? And do you care about friends? Would you like to return to the activities that you once enjoyed? Like, what matters to you, right? Sometimes as parents, we care so much, but we kind of impose our own agendas onto the teenagers, right? So it's really important to engage them. What matters to you? And then do more of what matters, right? You can change those markers, like what they value, and kind of help them turn it into actionable items. Could you text your friend more often? Maybe we can go outside for a walk, or even just 5 to 10 minutes a day. To kind of help them establish, kind of get back into that routine. Maybe have a schedule. I'm a very visual person, so sometimes I recommend having a visual calendar so the whole family can participate, right? And of course, if you do have concerns and you see some of these signs, schedule an appointment with a family doctor, speak to a mental health professional. And of course, if there's any imminent safety concerns, or you're really concerned about the safety of your child, 911, hospital emergency room, because at that point, it becomes a medical emergency that needs to be assessed.
Okay,
so I hope that was helpful.
Yeah, that's great. Thank you so much for that, Angela. This next question, I'm going to go to Dr. Marzouk. I apologize, I haven't gone to you for a little bit, so this is for you. We touched on it actually in some of the previous answers, but if you can elaborate a little bit more. You talked a lot about exercise and nutrition. So this specific question is, how can both exercise and nutrition help with mental health? How is that all actually tied together?
Gotcha. And yeah, so as we touched upon earlier, there's this huge interplay really between physical activity, what we put in, what we burn, and mental health and how we feel. And just wanted to elaborate on Heather's point that she made, that being active doesn't really have to mean going to the gym or heavy workouts. There's a lot of ways that we can be active. It is actually recommended that an average adult, like the research tells us, that we should do between maybe 75 and 150 minutes of exercise a week, which is really not a lot. This can be either of moderate intensity exercise, such as walking, hiking, biking, or it can be more vigorous depending on what we can endure, like running, swimming, even jumping rope at home. Any activity that raises the heart rate, makes us breathe faster, makes us feel warm and sweaty, counts towards exercise. There are many studies that looked at physical activity at different levels of intensity and its impact on the overall mood we have. And altogether, like, the research found that low intensity aerobic exercise, so 30 to 35 minutes, 3 to 5 days a week for 10 to 12 weeks has proven to be very effective in terms of inducing positive mood, enhancing this enthusiasm, the inertia, the alertness, and that get up and go feel. With exercise, we know that our bodies produce endorphins and dopamine, which are really as good as medication for mood, in mild mood. Like if there's a mild depressive episode, exercise can really be as beneficial as medications. It's also beneficial in mild pain when there's chronic pain. These times we're living have been really stressful on all of us. And the most common signs of stress, again, they include sleeping problems, loss of appetite, loss of motivation, sweating. Symptoms like such are really triggered by this rush of stress hormones in our body, which are known as the fight or flight hormones. And these hormones, namely adrenaline and noradrenaline, they cause elevations in blood pressure, increases in heart rate, increase in body temperature, in the core body temperature, and that's why we sweat. Preparing our body for an emergency response, it also When we're stressed like that, there's reduced blood flow to the skin and increased cortisol, which is a stress hormone releasing fat and sugar into our blood system to enhance energy. So physical activity and exercise is really a very effective way of relieving this stress and has been proven to reduce anxiety and depression, as we said. Now, you were also asking about diet, and diet is so important because the foods that we put in affect what our bodies are really made of, and particularly our brain. Like, it's responsible for neurotransmitters, or the chemical messengers in our brains that tell our body what to do and how to feel, and so on and so forth. The big neurotransmitters that I just wanted to brush upon would include serotonin, dopamine. We spoke about endorphins with exercise, and if we have a minute, on choline. But serotonin is the one to really highlight, and that is postulated to be the mood regulating neurotransmitter. In fact, pretty much most antidepressants we have, what they do is they're all acting in different ways to increase that level of serotonin in the body, particularly in the brain. Now, we know that serotonin exists in our guts, our blood, and the central nervous system. It helps give us that sense of calmness, and it helps reduce pain, reduce irritability, reduce aggression, and and there is, so the precursor to serotonin is known as tryptophan, which crosses to the brain and is a very sensitive, it's a very specific way that we can increase serotonin in our bodies. Foods that are rich in serotonin or tryptophan would include salmon, nuts, turkey and poultry, eggs, milk and cheeses, pineapple. And with winter coming, we know that there's this big interplay between serotonin and vitamin D. And vitamin D has a tendency to increase serotonin levels. So with winter coming, we're going to be wearing more clothes, less exposed to the sun. And that's really the theory behind seasonal affective disorder, because we produce less serotonin. So we gotta make sure that we're out there. We're exposed to as much sun as we can in winter when it's there. And there are ways of targeting that lack of sun through perhaps a light box. A couple words on dopamine. Dopamine, we brushed upon, it's another neurotransmitter, and it's responsible again for improving mood, but more alertness and ability to cope with stress. Low levels are really associated with high levels of depression and other mental health disorders. Foods that would be rich in dopamine would include, again, milk, eggs, fish. Tofu seems to be rich in dopamine as well. And maybe a word or two on choline. Choline is the last neurotransmitter I'm going to talk about. It's the precursor to acetylcholine. Acetylcholine is a chemical that is very important in memory. So in Alzheimer's disease, for example, what we're doing with the medication is we're trying to raise the levels of acetylcholine. It is part of the vitamin B complex, and healthy foods to keep our choline levels high would include eggs, broccoli, cabbage, cauliflower, chicken, beef, so high protein foods and greens. Veal is a really rich source of choline as well, and liver for people who eat liver or enjoy liver. Right.
Dr. Marzouk, thank you for that. And hopefully everyone has already had their dinner. If not, you're going to be hungry because you've listed off a lot of my faves there. I want to actually just switch to one question here because it's one that we got a lot. This pandemic is sort of been up and down for a lot of people when it comes to now what? What restrictions are there going to be? Who will we be allowed to see? There's a lot of the unknowns. So this question is, how can I manage expectations around an unknown timeline for ending the pandemic? It'd be nice to know that date for someone who is anxious to get back to normal. So managing those expectations. So this will be for Adel and Angela. Adel, I'd love to start with you.
Sure. Uncertainty is a natural and an avoidable part of our life. Just to remind us all to be compassionate with ourselves and validate and honor our feelings. Try to focus as much as you can on the things that you can control, that you do have control over. Take actions over the aspects that are within your control. Challenge your need at times for certainty. Identify, your uncertain triggers. What's triggering you to start worrying about the uncertainty? Learn to better tolerate, even embrace the inevitable, and see what you can do to reduce your anxiety and stress level, like whether that's being proactive with good sleep, exercises, a lot of people have touched, your diet, whether it's recognizing what's extra on your plate, as Heather had said earlier. Just be compassionate to yourself. I think everybody's going through the same thing. There's no playbook on this COVID. It's a new disease. We're all trying to figure it out as we're going through,
And just to add to that, I think it's important to remind ourselves it's okay to not feel ready, right? Oftentimes, I think maybe external sources and also internal within ourselves, we might say to ourselves, well, I should want to go back to normal, right? But then I don't. So then we start judging ourselves for feeling particular emotions or having particular thoughts. So then it's a double whammy then, right? So not only are we already stressed, anxious, depressed, we are then judging ourselves for having those feelings, or other people have lost their jobs. I still have a job. I should feel grateful that I'm still working. So how come I'm not feeling? So a lot of shoulds and muts. So those are judgments that we kind of place upon ourselves, right? So it's kind of really important to be mindful of that. And I also want to remind people that, the way out is going through it. And you are certainly not alone in your experience. We all have been affected by the pandemic in one way or another, right? So adding to what Adel was saying, try to establish a routine, get back to what's familiar to you. I've given some advice or tips to patients is that walk around the building. If you used to work at work, but now you're working from home, as a way to familiarize yourself, drive towards work or be around the building. For students, go to the school building, right? Just kind of have a physical feel to familiarize yourself again. And as Adel said, focus what's within your control. You have no control of how much toilet paper there is when you show up at a grocery store. That's completely outside of your control, right? But what you can control is, what do you do to try and take care of yourself and take care of the people around you?
Wonderful. Thank you so much. And for those who are watching right now, I'll give you a quick time check. I'm going to try to get one more question in there because it's one that was asked quite a bit. I was going to say stay unmuted, Angela, because I'm coming right back at you. But also, I'd love to get your take on this, Heather, as well. So this question being, are there options available for individuals who do not have extended health coverage and cannot afford to see a psychologist? So we'll start with you, Angela, please.
Yes, and that is once again a common question. And I think affordability is always a concern for people, especially during the pandemic. So firstly, check your coverage, because besides psychologists, social workers and psychotherapists can also do therapy. Your workplace might also have something that's called an employee assistance program. So what they do is sort of like brief counseling, but you don't have to have extended health coverage for that. I do know that if you're a university or a college student, a lot of the times student psychological services, they have therapists on campus to offer supports for their students. If you're in high school, or I believe it's grades 6 to 12, speak to the school, because some school boards may have access to referrals to mental health and addictions nurses. So that's a great resource to kind of tap into. Other places that I'm thinking about is there are some agencies such as Family Services York Region, Catholic Community Services York Region, Jewish Family Service and Child. They have a variety of services in the community. They do, it's not completely free, but they do charge on a sliding scale. So whatever people can afford, people can kind of tap into supports like that. I also know that there has been a lot of initiatives from the government to offer free internet-based CBT. So virtual CBT, some of them are self-guided with a trained phone coach, I believe. So things like Mind Beacon, WhatsApp walk-in clinic, the Bounce Back program. And of course, your family physicians can also make referrals to our mental health services within Mackenzie Health. The only difference is because we are an acute hospital, we tend to see people who are more on the moderate to severe side and having significant level of impairment in their day-to-day functioning. So that's the only criteria that we have that's different from the resources that I mentioned. Heather, was there something else that I might have missed? Maybe for children and youth, that's something I didn't talk about.
Yeah, that would be great.
Yeah, so York Hills or Kinark are places, they're really big mental health agencies in York Region that offer free supports and services to families and kids and teens.
Wonderful. And you wanted to add something, Heather, there?
I also think that sometimes we can get very focused on like the formal supports and therapy. And there's lots of things available. A lot of cognitive behavioral therapy techniques are quite open to people learning them on their own. So you can look at things like go to YouTube. There's a lot of therapists that produce a great number of videos. Some are better than others. That have information about panic, anxiety, psychoeducation. There's great resources available online where therapists do blogs. I know it can be difficult, but like some people have really great open content on Instagram, like whatever medium you do. Like it doesn't have to be just formal intervention because formal therapy is expensive for most people. It's not something that is just, I think a lot of people act or talk like it's only not something that's out of reach for people who are on the low income spectrum. Not a lot of people can afford therapy as they don't have that disposable income because it can be quite expensive if you don't have insurance. And even if you do have insurance, it's often not enough. So I often encourage people to look at it as do whatever you can. Even just spending some time understanding what cognitive behavioral therapy is and how it works can do a lot around, and you can incorporate that within your regular life.
That's great. I think that's actually the perfect question to end on right now. We have just a couple minutes left. I want to take this opportunity to thank you, Heather, Angela, Dr. Marzouk, and Adel. Some really great tips. And for anyone, again, who maybe is just catching the tail end here, this session was recorded. It will be posted, so you can go back for reference. And I just want to, again, thank all of you for joining us today, and also thank all of our frontline staff here with Mackenzie, who have been doing everything that they possibly can to keep everyone safe physically and mentally. This is such a very important topic, and I'm so glad to have been part of this conversation tonight. A lot of this, as you see on your screen here, it comes with community support. So just want to thank all of the donors who have been very vital in making organizations like Mackenzie Health be able to do their work. So thank you for that. And I want to say on behalf of the Mackenzie Health team, again, thank you to everyone who donated to the COVID-19 response fund, because that was significant, or perhaps even to the Ultimate campaign, because those made a difference. And I'll also just say, the doors to Mackenzie Health's second hospital, they are open, but they do need the community to engage and to help, if possible, to step up. They have the equipment, they need the technology, and the community needs and deserves all of this attention. It's been some time, and so definitely, if you haven't already, please do consider making a donation. Again, you're going to see that up on your screen. These are life-saving efforts. What you can contribute can make a world of a difference. So thank you again to our panelists. Thank you to everyone who joined us tonight. Everything will be posted for you later on if you missed anything. And thank you. Have a wonderful night, everyone. And please take care of yourselves.